Welcome to this World Sociology screencast, where we're going to look at the topic of health, development and inequality. This bar chart shows average life expectancy in different regions of the world. And there's a broad correlation between a country's per capita income, so how wealthy a country is, and its levels of health as measured by things like life expectancy, infant mortality, overall death rates, and incidence of particular diseases. This table looks at individual countries and ranks them in order of life expectancy, and over here we've got the countries that have got the longest average life expectancy, and these are the countries with the lowest average life expectancy. And all of these countries over here are in sub-Saharan Africa, where about 65% of deaths are the result of infectious diseases and causes related to birth and maternity. Whereas in developed countries, only about 5% of deaths have these causes. So in richer countries like these ones, the great majority of deaths are from non-infectious medical conditions such as heart disease and cancers. However, it's important not just to look at the average life expectancy for the country as a whole, because there are also important inequalities within particular nations. For example, if we take our own country, the UK, life expectancy for men is in the late 70s, as we can see here. But if we take one city within the UK, Glasgow, we can see some massive inequalities in terms of life expectancy for men. So Lenzie is quite an affluent area of Glasgow, where life expectancy is 82, so that's significantly longer than the national average. But over here we have another area of Glasgow which is very poor and deprived, and life expectancy is just 54, which you can see is actually much lower than some countries that we might consider to be developing countries, such as India and the Philippines. So whether we're looking at a developing country or even a developed country such as our own, there's a strong link between poverty and illness, and then illness can also lead to greater poverty. So what we've got here is a feedback loop which exists between poverty and illness, because each of these can affect the other. For example, this bar chart shows that poverty and lack of education perpetuate high adolescent birth rates. And having children at a very young age might significantly increase the complications surrounding pregnancy. In developing countries, poverty and access to healthcare services tends to be much worse in rural areas. So what you can see in this bar chart is that only 1 in 3 rural women in developing regions receive the recommended care during pregnancy. And the use of contraception is lowest amongst the poorest women and those with no education. Now, disease in developing countries tends particularly to affect children, and in sub-Saharan Africa, the biggest killer of children is malaria, and as we can see from this graph, poverty continues to limit the use of mosquito nets. And when children are unfortunate enough to contract malaria, it's children from the poorest households who are the least likely to receive treatment for this disease. So clearly the experience of poverty is one of the key factors that affects illness. But as I mentioned earlier, there is a feedback loop here. So the experience of illness can also lead to more poverty. For example, Jeffrey Sachs argues that countries which have a lot of malaria tend to be poor, that controlling the other factors, those countries where malaria is endemic, they have much lower GDP. In fact, he estimates that GDP in these countries is 30% lower than countries where malaria is not endemic. Now, despite these enormous challenges, modernisation theorists are optimistic that the health patterns of developing countries can follow those of the developed world in the past. So according to this perspective, if we look at the poorest countries in the world, they're still at the stage that developed countries were at several centuries ago. However, according to this perspective, the lesson to be learned from developed countries such as our own is that improvements in things like nutrition, hygiene and sanitation, along with the developments of modern healthcare and medicine like antibiotics, all of these things can lead to falling death rates from infectious diseases and dramatic reductions in infant and child mortality rates. So modernisation theorists argue that developing countries should draw on aid and expertise from the developed world. They should drop traditional medical practices and concentrate on centralised primary healthcare based on doctors and hospitals and on mass immunisation against disease. And according to Jeffrey Sachs, overseas development assistance, or what we more commonly refer to as aid, has had tangible successes in the field of health. So he argues that vaccinations have largely eradicated smallpox and have saved the lives of 7.5 million children simply by halving deaths from measles. So Sachs argues that for the first time in documented history, the number of children dying every year has fallen below 10 million, and that this is the result of improved access to clean water and sanitation, increased vaccinations, and the integrated delivery of essential care. However, dependency theorists are not as optimistic as the modernisation theory perspective. So they argue that there is no reason to assume that today's developing countries can simply follow the path of the rich world. And they argue that much of the high mortality and morbidity rates in poorer countries can be linked to the conditions that have been imposed upon them through both colonialism in the past and neo-colonialism in the present. So, for example, under colonialism, European diseases such as smallpox helped to decimate the indigenous population and allowed the Europeans to export massive amounts of wealth back to Europe. And also under colonialism, food crops were often replaced by cash crops, so small family farmers were often kicked off the most fertile land, and this resulted in malnutrition for the indigenous population. And dependency theorists argue that there continue to be a large number of exploitative practices that undermine the health of populations in developing countries. So, for example, the adoption of lifestyles of the rich world, for example, diets heavy in fats and sugars and processed ingredients, can lead to an increase in cancer and heart disease. And we've got transnational corporations who are in a position to sell these products, to advertise them irresponsibly, and are often so powerful that they can avoid attempts to restrict them. And pollution and environmental damage caused by the activities of transnational corporations can also affect the health of populations in developing countries in adverse ways. So, for example, these two images are obviously about the recycling of e-waste in developing countries. And this can lead to the pollution of the air, of water, and these factors can obviously adversely affect the health of populations who are responsible for recycling this waste. And the big pharmaceutical companies have often been reluctant to make their medicines either available at prices that people can afford in developing countries, or to allow developing countries to manufacture their own cheaper generic versions of these drugs. And finally, dependency theorists have also been critical of the impact that structural adjustment programs have had on health provision in the developing world. So under these initiatives, countries are given loans on the condition that they cut back on public expenditure with a consequent impact on health provision. And the result of these types of processes is that the medical staff and infrastructure necessary to improve the health of nations is simply not feasible.